It has become necessary to take additional measures to stem the spread of the virus and protect the lives of our people. All our borders, that is by land, sea, and air, will be closed to human traffic for the next 2 weeks.
So how is it over there? Like, what's the government done? Has the schools shut?
Okay, so I must say they've been pretty on it.
Mm-hmm.
So, well, in my opinion, the schools shut down it's been almost on the 20th. Yeah, on the 20th they shut down. So it's been a while. So my oldest daughter's school, they actually shut down because it was only a week of school before they had a midterm break.
Okay.
So actually we were only on virtual learning for a week, and then we have holidays basically.
Oh, that's
anyway. And a lot of the schools have midterm breaks around this time too. So I guess it was convenient in that way for a lot of the international schools. But the first people to close their doors were the international schools. And then a few days later, the president came and gave an official speech. And he's like, all schools are going to close, primary, secondary, whether you're a private school or you're a public school, you're closing down. But he still allowed people that had exams to go for those, the study groups and all of that, but with precautions. So exam halls and that sort of things have disinfectants, and everyone has a mask on and gloves. And so he was pretty reactive in that sense. And then it was I think it was last week, Tuesday or Sunday, I can't remember exact date, that he closed down the borders. So air, land, and via sea, everything's closed down since almost a week and a half. And the good thing was that I feel the first time that he gave the first speech, it was before we even had a case. But he was saying in his speech, I know that we don't have currently any cases, but in terms of travel and how connected the world is and how global we are and how many Ghanaians that are out there that might be returning, we are expecting it to hit us too. So here are the precautions we're going to take. So I feel it was quite responsive here in Ghana, and really there were hotlines set up.
Oh, was there?
What?
They took,
yeah, so
they took it really seriously in comparison to how they took it here in the UK. They waited and waited to do anything. In Ghana, they took action before anything happened.
Yeah, no, I think for us, sorry, people are bombarding me with all kinds of news, fake news and real news, everything. So my phone's gonna go off a couple of times. No, I think the thing for us is that obviously we saw what was happening in the West, So it was sort of we could pace ourselves and expect for something to happen to us. So I think the government had already been speaking about it well past, Mm-hmm. So when it came, it was easier for them to come out and respond. I mean, sometime this week, they even went to the local markets and one of the biggest one, Makola, and they hosed everything down, with the big trucks, disinfected the streets.
Yeah, disinfectant spray. I saw pictures on online. I'll try and insert some here as well.
Yeah.
And I thought, wow, nobody's doing that over here.
Yeah, no. So I think they've been very responsive. I think I know that all the first cases that hit us were as they described it, imported. So either it was expats returning, or it was tourists coming in, or it was Ghanaians returning, that lived outside, returning to Ghana, that brought it with them. So, which makes sense, obviously, because it was happening in the West and in Asia. Yeah. So it was obvious that it was going to be coming from outside in. but the numbers have risen like in the last week drastically. I mean, we started out the week, I think, at like 60 something, and now we're at 93 and 4 deaths already. But they're proactive. Like, there's a website, a government website, where you can go and check the numbers. They update it every single day. They tell you exactly why the people died, under what circumstances. All 4 people were past the age of 60, you know, so, and they had health conditions already standing. They update it like crazy, you know, and the president gives every week a speech. So tonight, actually, he's supposed to give another speech, because yesterday there was a lot of talk and rumors about lockdown, like official lockdown complete. And he came and he said, I want to clear the rumors up, that we're in discussions about it, and we will come back and give everybody feedback on what we want to do. But right now we're in discussions. It hasn't been decided upon. So tonight, actually, everybody's waiting to hear from what the president's going to say. But it seems like lockdown is going to happen. That's what it seems like it's going to happen.
And has shops shut down? And have you been to any supermarkets since this happened? And what is it like there?
Yes, so people were very responsible, I must say. Like, all the night places to go and chill, except for one place, everybody closed down. Everybody went on their Instagram and said, we're closing down. This is irresponsible for us to be open due to the circumstance. And sorry, it's not Corona. I'm just coughing a bit. So a place which is a pretty well-known place, Bloom actually even went online on a Friday night and threw a party online. So everybody was like online, you know, like doing the regular stuff. Like, hey,
well. It was actually so fun, and it was perfect. I was looking for good Afrobeats, and then I went on there and I was like, woohoo!
See, it was amazing. And like, the DJ was on there. Our favorite bouncer that everybody knows was pouring him a drink, you know. Like, they did it at Bloom with the signage at the back, but it was like very responsible, you know. And then right after that, a lot of other places came forth and said, we're closing down. Twist did the same thing. So it's like, I think people took it very serious from the start. Like, even the company I work for, literally 3 days before like the first case hit, my boss called me and she's like, my boss like is my neighbor, you know. I could easily have said to her, hey, we haven't been anywhere since a week. This is the people I've been in contact with. We're okay to meet up and do our work. And she's like, no, you know what? Stay at home. You have kids. I don't want anything to happen to you. I know I haven't been in contact with anyone, but maybe cases might arise. So let's work from home. And a lot of businesses were like that. The thing is that like a Koala, a Maxmart, which are like big shopping centers, have not officially closed their doors, but they've moved online. So they have home delivery services now.
Oh, that's so good.
Yeah, so you can basically call them. What we have here is an Okada. I think everybody knows what that is, like a motorcyclist. And the Okada brings your groceries to your house. Every single place that I've been in, whether it's petrol stations, whether it's a pharmacy, even a kiosk, like a side of the road place, everybody has a tank of water and they have soap in front of their place, and they won't let you in unless you wash your hands and you disinfect. So I feel like overnight everybody was like, okay, this is serious, we're taking it serious, let's go ahead. But there have been like the few cases where people have been a bit silly and they've been like, oh well, it's just a cold. Which, okay, if you have a certain strain of it, it might feel like that, but there's different strains of this thing going around, so you don't know what you're. The other crazy thing they did is they shut down 3 hotels in Accra, and they turned them. Yeah, this has been two places I can tell you of. The Marriott got shut down in airport area, and then I think the second one was La Palm. Okay. And the military shut those 2 places down, cleared everybody out, and they're quarantining the people in there. So they're actually converting the hotels into quarantine quarters because there's rooms.
So who is that for? People that have arrived into Ghana, or people that are showing symptoms?
So it's people that arrived into Ghana with either one person on the flight showing a symptom and they feel like everybody needs to get quarantined for it, or like several people on the flight showing symptoms.
Right.
Or it's people that were like crossing into the border, individuals that were showing high symptoms.
Right.
So like one case I heard was 125 people were all quarantined in one day.
Wow.
And I think over 1,400 people were being tested in one day and quarantined at the same time. So that's what I'm saying is they've taken it very serious. Unfortunately, in Accra, there's only one place that provides that test, is a teaching hospital. So they don't want to also over capacitate the place because it doesn't have as many maybe beds and that sort of thing. So they've converted those 2 hotels, well, actually more than that, into quarantined places, you know. So they're taking it serious. They said 53 people out of the 93 were people that showed symptoms once they were in general population. So those people came into the quarantine afterwards, and the rest were people that were coming into the country and showed symptoms. But like I said, there's hotlines as well. A friend's family member recently called one of the hotlines. They came to her house, they quarantined her in her house, and they gave her the test. And I think within 3 days or 2 days, she had her test back negative. So
do you have to pay for that service? Do you know?
yeah, I'm pretty sure you have to. I don't know 100%, but I'm sure you have to pay for it.
Okay.
I'm sure. Yeah,
And
because we don't have general insurance or healthcare, that kind of stuff, you know. So
and I guess has the government said anything about supporting people that are going to lose money through this, like businesses and that sort of thing?
So they haven't specifically said that they would support, but what they've said is, you see my phone's blowing up. What they said is that Nana is our false, that they're still in discussions about the lockdown. And in addition, the reason why it's such a long discussion is because they know the average Kenyan maybe might not be able to afford to stay at home for a lockdown of 2 weeks. You know, it's a lot of people are day-to-day survival. So they're trying to figure out what is the smartest way to move forward and how they can do it in the best way so that those people will not also lose out. So they haven't said that they would provide anything for those people, but they haven't said as well that they would mandate those kind of situations to lock down. So I don't know what's going to be announced tonight. But everybody, I can tell you, like I went out today because there are all kinds of rumors flying around, all kinds of WhatsApp threads. Some of the people I know, like, they're serious when they're sending stuff. So it gets you very confused. But because of the speech tonight, everybody's expecting lockdown. So I went out to go and get like the water because we have water dispensers in my house. I went out to go and get it. Everywhere was like, it was done. There was no water anywhere.
Wow.
And so I had to like drive like 20 minutes out of like my range. No, actually like almost 30 minutes out of my range and find like a kiosk kind of shop to get one, right? And I mean, all the general places, like the parking lots, you couldn't even like park. So I knew not to even go in those places, you know? So everyone's just like, people are going crazy tonight, like just trying to get like their last minute stuff, you know?
And
For the
is the shops like, is the shelves bare or anything, or is there food on the shelves?
No, there's food everywhere.
Okay.
There's food everywhere. It's just like the like standard things are like
Water.
I think the first week that it hits us, like, you know, the toilet paper was getting low. What else? Like water, like in the smaller bottles there was a lot of them, but like the dispenser water was like going finished. Yeah, so like the general stuff, or like hand sanitizer, like I had a friend that went up and down her road to different pharmacies. She hit like 10 different pharmacies, couldn't find even one place with like hand sanitizer, rubbing alcohol, nothing. But So like the important stuff like the gloves or the medicines, they're like, okay, per person, two packs I'm selling, that kind of stuff. So yeah.
It's really,
But
I mean, it's really promising. You know, like I feel like they're just taking it so much more seriously than I would have thought that they ever would have. And especially
yeah.
in comparison, I'm sitting here in Scotland, and it's a different story. Like we have basically been told not to wear masks, but I am actually still wearing a mask when I go into shops. But like we've basically been told not to wear masks. You know, it doesn't make a difference. But over there, and in China, everybody's wearing masks. And I'm
Yeah.
in Ghana,
Well, I
shops,
think
some people are
I
wearing
think the I think there's generally a lot of things like there's there's a lot of like fake news out there. There's a lot of like different research that is like clashing heads with one another. So like the mask thing is like one research group might say have the mask because at least it's some form of protection. So if the particles like fluids come like like
yeah,
they're
some
saying it's
people
airborne to some extent. Yeah, and then some people are like, oh well, it's not airborne, and then some people are like, yeah, but you have the mask on, mm, like you
yeah,
have to
so
regularly
it's
change.
difficult to know what to do.
Yeah, but like so it's a bit complicated with that kind of stuff. Whereas in Ghana, I feel like everybody's like wearing a mask, wearing a bandana. Like I'll be honest with you, like my sister is Muslim. She's a hijabi, so she covers up, and so every time I've gone out, I've covered up as well.
Okay.
And I feel like people, but it's not for me. It's not like I've done it to like take advantage of somebody else's religion, because for me obviously I'm researching and I'm leaning towards that. But I must be honest, like the way a hijabi is treated in Ghana versus like anybody else is different. Like people don't come into your personal space, they're very respectful. So I went shopping, people held their distance, were very respectful and all of that, because obviously in that religion also there's certain limits to like human to human contact, like with a man shaking your hand, that kind of stuff. So I've seen it, like I've seen a whole bunch of friends that I have that are Muslim by birth, but maybe they don't practice like the hijab covering. And then this week I've seen everybody like covered up, like telling me their stories and stuff. So I feel like everybody's trying to make an effort. Everybody takes it extremely serious. We have seen also cases like people close to us that have caught it. So I think that's what makes, in my circle at least, it's like,
Yeah, very real.
okay, yeah, this thing is real. This is not some like far-fetched thing. And I'll be honest with you, it's affecting the people that earn a bit more. You know what I mean? Because those are the people that got to travel outside of the country. So it's affecting a certain, I hate to say class because I know I get backlash for it, but in a society like ours, we have like different financial classes. So it's hitting like the upper financial class, if that makes sense.
I feel like
Because
that's
those,
for now. Like for now, that's maybe the first people, because that's soon going to
yeah.
trickle down to
Oh yeah, for
everyone.
sure. Because I mean, especially in our culture where everybody's interconnected, like you're constantly in contact with other people. It's not like, let's say, like in India where you have a caste system. We don't have that. There's just financial classes in that sense, like different people earning different amounts sit in different kind of like societies. But we're all very interconnected. Like in Ghana, somebody maybe that works for you might not be earning as much as you, but they're almost like family to you. They're around your kids, they're around you. So obviously it's going to trickle down. It's going to affect everybody. But that's also why it's like it makes sense for the most part to do the quarantine, because then everyone is stuck in their situation until it gives us enough time to get over it.
I mean, I
Yeah.
really feel like for me, I'm thinking of people, I guess it's like people that are living outside of Accra, because Accra is
Yeah.
very much like, there is hospitals there and they're obviously making efforts. But I wonder outside of Accra what's going on. But then again, it's like, I hope it wouldn't get to certain places because people might be traveling there right now.
Yeah, for sure. I mean, I know that the first case of the person that died was in Kumasi.
Oh, really?
which, yeah, yeah. And Kumasi is our garden city. I mean, it's as big as Accra. It has as much resources as Accra. It's just maybe in Kumasi we're a little bit more like down to the culture, if it makes sense. But yeah, the first case, a person that died was in Kumasi, and it was a Lebanese man that has like lived in Ghana all his life, you know. Um, so like we already have a case outside of Accra,
Yeah.
but obviously everybody knows like the international airport is in Accra.
Mm-hmm.
So the cases that were coming in were from Accra. That was the first hit. But the fear is just people from Accra might start to travel outside and then spread it, you know, or they might try to pass it down to people here that might try to go back to their villages, you know, like in fear of what's going on in Accra.
And then
And then it spreads. Yeah, and there's only like Ghana is a big country, you know. We forget about it, but it's a big country. So, and it's hard to trace these things because not everything is monitored in our country, you know.
Yeah.
There are places that like half of us don't even know exist in the country, you know. So it becomes dangerous in that sense. And that's where I'm like 50-50 on it, because I'm like, quarantine makes sense to slow it down, but at the same time I know how much like it's going to affect people's lives that cannot afford to have that privilege of sitting at home and waiting it out, you know. And then the question becomes, do you want to do that and have people starve out of the situation, or do you want to do that and anyway prevent people from dying from a disease that they will not have financial means to be medically attended to either? So
It's so difficult. Like, hopefully now's the time where the government are gonna take that money that they might have and, you know, spread it with the country and the people that need that help, like the medical
yeah,
attention, and potentially like some sort of form of benefits or aid at this time to help people that
yeah,
can't like get it through this time. So let's just
yeah.
wait and see.
Yeah, let's see what they announce tonight.
Yeah,
Let's see.
thanks so much,
Hopefully,
Ella, for chatting to me.
hopefully it's over soon.
Yeah, yeah, I know. I'm like, how long? Like, I mean, I'm obviously like, my heart goes out to everyone that's affected by this.
Yeah.
In a personal sense, I am also like, I've been in the house for 2 weeks now, and
Mm.
it's not easy. You know what I mean?
I won't lie to you. I've always been a homebody, but
Yeah.
since I moved to Ghana, it's like I've been a social butterfly, and
Mm-hmm.
I didn't realize how much I missed being at home until now. And I'm like, I have the time with my kids, you know, like I get to work from home. I'm excited about it, but obviously I know not everybody is in that situation, even mentally. And for me, the only thing that's really gotten me is like I had pre-existing OCD after I gave birth to my kids. So when this thing happened, like I was going mad. Like I was stripping the floors, scrubbing the floors per hand. Like I was going crazy, you know. So I can only imagine like the people that have like
Mental health.
health conditions or mental health conditions, what they're going through, or even just like we're talking before, the financial part, like being stuck
Yeah,
at home
it's
for two
so
weeks.
stressful.
Yeah, that's very stressful. Like today somebody almost tried to like cheat me out of water. No, so I went to go buy the water dispenser tank and supermarket, you know, and I could see like the woman seemed a bit desperate because she knows she has maybe she has to shut down, you know, tomorrow. So I asked for like 3 bottles, and she was trying to push a fourth one on me. But I could see it's like I could see the desperation, you know. So she was like, "Well, I can't sell you an one by itself. I'm selling them in pairs." And then her daughter comes and didn't hear the conversation. Is like, "Yeah, you want 3? No problem. Here you go." And then I could see like the woman said in tweet to her, thinking I don't understand. Like, no, we have to sell them in pairs. What if tomorrow is a shutdown, you know? And like because of that, I bought the fourth one, right? Because I was just like, I know I have not been in that situation, but I know the desperation, especially as like the breadwinner of the family, to know that it could be like the last time you sell something and it could like financially hurt your family, you know? So for me, it wasn't like she's trying to cheat me. It's like she's and
Yeah.
I can't just let this go, you know. Like I have a financial advantage, I should be helping out.
Yeah.
So I can really imagine the panic for people that live day to day, what this means right now, you know.